guys, welcome back to my channel. It's your girl, Island Girl Shan. If this is your first time here, welcome. Make yourself at home. But if you've been here with me since day one, thank you for the continued support. I really appreciate it. Now, if you have not done so yet, please go ahead and click the subscription button down below, as it really supports my channel and I really appreciate it. Okay, so let's jump right into it. I am going to tell you exactly how I studied and got a level 3 on my ATI proctored pharmacology exam. Okay, so first things first, the dynamic quizzes. The dynamic quizzes in the ATI platform are a great resource. If you have not used them yet, start using them now. You can create your own quiz, however long you want it to be or short. You can have it untimed or timed, or you can have it generate a quiz for you. Just any old quiz with any old subject topic. You can play around with it. So I highly recommend it. Before my exam, like 2 weeks before, I started doing specifically pharmacology subject topic, and I was doing like 100 questions a day. Now, I know you're probably like, wait a minute, 100 questions, that sounds like a lot. Not really, because I was doing 20 questions at a time. And I would do 20 questions, and then when I was done, I would read the rationales and then take a break, and then later on, I'd do 20 more. And quickly, you do 100 questions within a day without even realizing it. So I really recommend it. Also, for that platform, I don't recommend you doing it in study mode, to be honest with you, because the study mode does not contribute to the performance metrics, which tells you what your average is and how you're doing and where your percentile ranking is. So I would do it either in the test mode or the adaptive mode, because those two things contribute to your performance metrics, and it will give you a good overview of where you are as far as that subject topic is concerned and how you can improve. Okay, another thing that I did, past tense, is I read this book, the ATI Pharmacology book, cover to cover. And to be honest with you, I don't recommend you doing that, because when I was done reading this, I was just as confused as before when I started it. So I don't recommend you doing that. You can use this as a reference point. Like, for example, if you come across a particular question in ATI and the rationale doesn't quite make any sense to you, you can always look up the chapter that it corresponds to and read over it. But reading the book cover to cover, I don't recommend doing that. What I do recommend, however, is grabbing this book, the pink book, which is like what they call it, the Cliff Notes version. It has all the ATI subjects: fundamental, med surg, pharmacology, maternity, community, leadership, all of them in this one book. And in each of the subject matter, they are condensed. The information is condensed down. So it's pretty much what you need to know about each category of drug. Yes, it was very concise and to the point. I also reviewed this book, which is Pharmacology Made Insanely Easy. Now, you don't have to run out and get this book if you don't want to. It's a plus, but it's not a must. You don't have to get it. If you already have it, it's a great resource. But like I said, you don't have to get it. It's just another way to reinforce the information that you already know. Another resource that I used was the videos here on YouTube. There was 3 specific channels that I tuned into, and I just was listening to their information. I took notes to their information. You know, I added to my notes, and it was simplenursing.com, LevelUpRN, and RegisteredNurseRN. They are great resources. But I really highly suggest you finding a channel here on YouTube that works for you. There are plenty, trust me. It's just a good way to keep the information in front of you, and also the way it's broken down. Maybe the lecture wasn't doing it for you, and you can find great video resources here. What I would recommend, however, is depending on whoever's video you're listening to, make sure that their lab values and like their therapeutic ranges are coincide with that of ATI, because of course ATI is going to go by what their information is or whatever information they're giving us. So make sure their lab values, you know, their therapeutic ranges, their toxic ranges are they coincide with those of ATI, because you don't want to be listening, not that they're wrong, but everybody's is usually off by a little bit. That's why there's a range. So just make sure that you're watching videos that coincide with the information that matches the information that ATI is going to test you on. And that's another reason why I say read the pink book. Read this, because they have a table and a chart that's going to give you that information, and it's exactly what you're going to get on the test because it's ATI. Also, know your insulin onset, peaks, and duration. You just have to know them, know the different types of insulin, and know what their onset, their peak, and their durations are. There is a great table in this book that just has it already outlined for all of them, and I highly recommend you reviewing that. Start early, start studying early. That's what I did. I started about 3 weeks prior. I was already reviewing the information little by little since January, but I started really like buckling down on the pharmacology information 3 weeks prior, and I went over every drug class. I started with the ones that I knew nothing about and worked my way back to the ones that I was already familiar with. Also, I recommend having a study partner, discussing the medications and their side effects and all of that. It's great to listen and talk it out with somebody else, because that conversation tends to stick. So I highly recommend, forming even maybe not a big study group, because I know that not all of us do well in big study groups, but having a study partner to discuss the stuff, kind of bounce ideas off, kind of have that critical thinking discussion with, really helps to solidify the information. And if you're anything like me, when you go to clinicals and you see the drugs, look them up. Look them up, because having that information right there in your face, you're more likely to remember something that you're having a hands-on practice with. And that's what I did. A lot of these medications, furosemide, enoxaparin, I saw them at clinicals, and that's where they're really stuck in my head. So I didn't have to go review on those medications because they're already in my head. Pay attention to the medications that you're passing at clinicals if you're allowed to. But yeah, that's about it. Do review the dynamic quizzes. Take as many of those as you can. If you struggle with time, because ATI only gives you a minute per question, I would highly recommend you practice the dynamic quizzes timed. That will help you get used to reading the questions quickly and choosing answers quickly. Review the chapters in the pink book, and discussing medications with a study partner, and reviewing and the resources here on YouTube. I will link the channels that I listened to and I reviewed listening to down below in the description box. But like I said, you have to know your lab values. You have to know your glucose, your insulin ranges. You have to know those, know their names, know what their onset, duration, peak is. Also know what they are used for. If they're short acting, if they're long acting, you have to know all of those. And that's about it. Start early. Don't wait. The week of the exam is not a good time to start studying. I recommend you start studying early. The earlier the better, and get yourself comfortable with the drugs. The earlier the better. That's all I can say, because that's what I did, and I got a level 3. And that's it. I wish you the best of luck. Hopefully this video helped in some way, shape, or form. And I will see you for the next one. The next exam I have is Med-Surg, so fingers crossed. I already started studying for that, so we'll see how that one turns out. Until next time, people. Bye.